Hi, my name's Ellie. I'm going to be your nurse today. Can I ask you what your full name is?
Hey Ellie, my name's Kendra Sanders.
Okay, and how old are you and what is your date of birth?
I am 26-year-old and my birthday was May 4th, 1998.
Perfect. And then what pronouns do you use?
She, hers, and hers.
Okay. And then what is your current job?
I am currently unemployed.
Okay. And then are you in school right now or?
I am in the nursing program at Mount St. Mary's.
Okay, awesome. So what brings you in today?
Actually, related to that, I am here for my physical.
Okay, like a yearly physical that you have to do.
Yeah, we have to do it every year, just kind of yearly to make sure everything's going right. We did it earlier this year, but because it's expiring, we have to come in and get it done again.
Awesome. Okay. And then just for past medical history, have you ever been hospitalized at all?
No, I have not.
Okay. And then do you have any like childhood illnesses or chronic conditions that I should know about, like diabetes or asthma or any anxiety?
I was never clinically diagnosed with asthma or diabetes. Sometimes I am a little anxious, but I've never been to a therapist for it or
Okay.
anything.
Okay. So never gotten like a clinical diagnosis for it. Okay. And then do you know if you're up to date on your vaccinations?
Yes, I am currently up to date with my vaccinations as I've had to get them to be admitted into nursing school.
Okay, amazing. And then have you ever had any surgeries before?
Yes, I have had a hernia repaired and I got that done in 20 January of 2021.
Okay, and where was that hernia located?
Uh, it was inguinal
Okay,
on my right
inguinal.
side.
Okay, perfect. And then were there any complications that you had with the anesthesia, or was everything okay with that surgery?
No, no complications.
Okay, and then any allergies to medications or foods or environmental allergens that you know of?
I am allergic to amoxicillin and I'm not allergic to any foods or anything like that.
Okay, what kind of reaction do you get from amoxicillin?
I break out in hives, full body hives.
Okay, good to know. And then just going into like family history, do your parents or your grandparents have any chronic illnesses like diabetes, cancer, any heart issues?
My mom's okay. My dad does struggle with high cholesterol, but he
Mhm.
is managing that with medication.
Okay, great. And then do any of your siblings have any medical conditions that you want to let me know about?
No.
Okay. And any relatives that have passed from like a specific illness that you'd want to bring up?
No, everyone in my family, sadly, well, I guess not sadly, but dies of old age.
Okay. Yeah, so pretty healthy overall. Okay. So, do you have any issues with like skin, hair, nails, like rashes, any hair loss?
Um, I do have pretty sensitive skin, so I am going to the dermatologist for that. But I do have hormonal acne that they're treating me for.
Mm-hmm.
That's kind of separate. I'm dealing with that by myself.
Mm-hmm.
Otherwise, my nails are good and everything else seems fine.
Okay. And then are you on a medication then for your skin with a dermatologist?
No, not at this time.
Not at this time. Okay. Do you have any headaches, vision changes, hearing loss,
No,
any sore throats or sinus issues or dental problems?
no,
Um, any shortness of breath or chest pain or swelling in your legs?
no,
Any nausea, stomach pain, or bowel changes?
no,
And then any like menstrual irregularities or urinary issues lately?
no.
Okay. And then any joint pain or muscle stiffness or weakness?
I do have some joint pain in my back and my knees. Previously, I did play a lot of sports and I kind of just like
Okay.
overtrained and I couldn't really um, like tell like what was kind of going on. So I do have some like chronic back pain and stuff. But
Mhm.
right now it's fine. I manage it with just like Tylenol every once in a while, but
Mhm.
that's once in a blue moon and everything's okay. But other than that, I think everything seems fine.
Okay. So it's not like really affecting your day-to-day life necessarily, but more like every once in a while, and you're able to manage it okay with the Tylenol?
Correct.
Okay. And then along with that pain, do you ever get any like numbing, like any numbness or tingling or any dizziness?
No.
Okay. So walk me through like what a typical day for you looks like. Like, what do you normally spend your time doing? Do you regularly exercise? Like regular eating habits?
Um, well, that's kind of, I guess my days kind of vary because I'm in school right now, so everything's like pretty
Yeah.
structured with that. For diet, I typically, I wake up, I have my cup of coffee, I have my little protein shake, and I make an English muffin, PB&J. It's my
Hmm.
favorite thing. And then for lunch, I pack my lunch, and I also pack like a brunch breakfast break of overnight oats, and I do that with like oats and chia seeds and like fruit. And then for lunch, I usually try to pack a protein. So I'll do like chicken or steak, and then I'll have a veggie and usually like rice or a sweet potato. I
Hmm.
also, right now, I'm like really into chomps. So I do a chomp bar and maybe a piece of cheese. And then I come home, and that really just kind of depends what everyone else is craving in the house. But I usually try to pick something that we usually go for Mexican, so I'll do like a burrito bowl or something like that. And then for my typical day, I usually like wake up early in the morning because I do commute to school. So like when I have my clinical days, I probably wake up around 4:30 and then I drive up to UCLA Santa Monica and I'm there until about 3:30 and then I kind of bear the 405 traffic and I
Hmm.
get back to campus, I mean back to my house, and then I kind of just like do homework and everything else. Did that answer all the questions for
Yeah,
that?
that's perfect. Okay, and then are there any medications or supplements that you're currently taking?
I'm not taking any medications currently besides, like I said before, the Tylenol from when my back hurts. I'm kind of not really doing anything for my acne right now because I'm letting it kind of just mellow out. And any previous medications I've stopped taking for the past couple of years. So,
Okay, so no current like prescription medications right now. Do you
correct.
smoke or use tobacco?
No.
Okay, do you drink alcohol?
I don't drink right now since I'm in school, but definitely if there's a spring break or anything or a weekend or a friend's birthday, I'll have a couple glasses of wine.
Okay, so just on occasion.
Correct.
Have you used any recreational drugs in the past or currently?
No.
Okay. And then how do you feel like you've been able to handle stress in your day-to-day life? Do you feel like you're able to cope well?
I definitely think I'm able to cope well. I definitely have been like leaning on my friends in the program. They've been like really helpful with like managing my stress of like all the material we're having to go through. So they help me make study guides and kind of just make sure I'm catching everything in class and we'll go over notes together. Sometimes if I do get stressed out, I'll just like take myself for a walk and kind of clear my head. But I think right now I'm doing okay. I think after I got over that first semester hump, everything went well.
Okay. So would you say that there's like some school-related stress in your life right now?
Then I guess I would say yes. Um, I guess it kind of just like comes like with the program, so I don't
Mhm.
try to think about it too much.
Yeah, but you feel like you're able to cope well with it?
Yes.
Okay. Who do you live with?
I currently moved back in with my parents to attend
Mhm.
this program because I quit my previous jobs. So right now I live with my parents and my younger brother.
Okay. And do you feel financially stable in that environment?
I do feel financially stable in that environment. Of course, I would always like to, have a job and make money, but I know right now I am sacrificing my time for something that'll kind of put me up uh, comfortably in my future. So I think right now I am comfortable, a little frustrated that I can't work, but I'm willing to work in the future and kind of pay back my loans and everything else that's going all right. But my parents are doing okay and everything's okay in that
Okay.
department.
And you feel safe at home?
Yes, I do feel safe at home. We're all, hang out with one another. My brother's my best friend, and we kind of just like still take the time away to like, have a family meal.
Awesome. So, who would you say are the people that you're closest to?
The people that I'm closest to would definitely be my younger brother and my parents, because we're all, living back home together and getting everything kind of. I moved away for my initial undergrad and then I moved back home. So this time I kind of just I'm taking the time to spend like with my parents. And then outside of my immediate family, I have my friends that I've made previously from like, past school, and then I have also made new friends in the program, and they're really cool.
Awesome. And then how would you describe the neighborhood that you live in? Does it feel safe? Like what is that environment like?
My neighborhood is pretty safe. I've kind of lived in Old Torrance for my entire life. Everything kind of just is pretty straightforward and quiet. Nothing too crazy ever happens in Torrance, so I definitely am hoping to move back here after graduation and I make my own home here.
Awesome. And then access to food and healthcare. Do you feel that you do have good access to those things?
Yes, I do believe I do have good access to food for sure. My mom cooks for me still, so I'm not going to make any complaints there.
Mhm.
Um, Also, I'm very fortunate that, I get the free meals when I go with my parents to
Mhm.
restaurants and kind of get everything sorted. So food, yeah, not a problem right now. I'm still able to eat all my favorite foods. And then what was the other question that you asked?
And then that's the main thing. Just also healthcare as well, that you feel like you have access to proper healthcare.
Oh, yeah, that's right. I definitely think I have access to proper health care. I'm able, come here today and get a health assessment for school, and our school definitely has resources that I'm taking care of. Sorry, that they're being taken care of. So that's really cool.
Okay.
And
Awesome.
yeah.
Cool. And then it sounds like you feel like you have a good support system around you for the most part.
Yeah, I definitely feel like I have a good support system. Like I said earlier, like I'm pretty close with my family. I have my friends out there too. And then was able to save some money during the program, so I do have a wiggle room in there.
Awesome. What would you say is most important to you in life? Like any like personal values, core values that are important to you.
Um, I'm not religious by any means. I was raised Catholic, so sometimes I do kind of like take that into consideration when I'm making my decisions because that is important to my family, in particular my mom. So I just kind of, err more on that side. I think that's why, like, I'm coming here for my physical, but like, if I were ever to get care at any type of like hospital or facility, our first choice, like in our family, is definitely Little Company of Mary in Torrance, because
Mhm.
it is a Catholic hospital.
Okay, good to know. Okay, and then are there any other questions that you have for me or anything else that you need?
Yeah, I do have a couple of questions. I was just wondering, because I am getting a physical here and I am doing it for school, I was wondering if you would be okay with like filling out my paperwork, that I have to get filled out or anything like that. Would that
Yeah,
be with you?
yeah, that's totally fine. Yeah, you can definitely fill that out and get that signed for you. And then are there any like vaccinations that you also need to get while you're here as
Yeah.
well, or any testing done?
No, I'm fully up to date on my vaccinations, but I was wondering if you can give me a couple resources and where I can get a drug testing done. Because I went to kind of a place that wasn't really in my area, so I was just
Okay.
wondering if that was a thing you could offer.
Yes, definitely. I will make sure that along with your paperwork that we get, like along with the physical form that's signed by me for the school and that paperwork, I'll also give you some resources for some nearby places that you can get some drug testing done at.
All right, awesome. Thank you so much.
Okay. And you said Torrance, right?
Correct. All
Okay, perfect. Well, thank you so much, Kendra.
right, thank you, Ellie.